Welcome to evergreenmd.org. I'm Matt Jablow, and this is the Evergreen Health Outlook. Joining me now is Dr. Peter Beilenson, the founder and chief executive officer of the Evergreen Health Co-op. Dr. Beilenson, there's obviously still a lot of confusion out there about what exactly is the Affordable Care Act. What are some of the most important things that the average Maryland resident needs to know about the Affordable Care Act?
Well, the Affordable Care Act is very complicated. It's 900 pages long, and there's a huge number of things included in that. But probably the two or three most important things are, depending on your income, if you're very low income, and you can look at our evergreenmd.org website to see a chart of where you would fall in the income range. If you're very low income, the state of Maryland has expanded Medicaid coverage significantly, and you may be eligible for, at no cost, Medicaid coverage. If you're of a working class income level, you're very likely eligible for premium subsidies, where the federal government helps to make more affordable policies that you'll be offered. And you can go on the exchange, which we call the Travelocity of healthcare, and see the different options that you have for your family or yourself, and the costs and what benefits are provided. And that is a significant improvement in terms of access to more affordable care than was previously available.
There's clearly been no shortage of debate on both sides of the Affordable Care Act. In your opinion, how significant is it for most Maryland residents?
I think this is probably the most significant health care reform in 50 years. However, that being said, there are a lot of failings of the Affordable Care Act, and it's incredibly complex. So I would argue that it's significantly better than the current healthcare system, but there's still much to be done.
What are some important dates coming up as far as the Affordable Care Act, and what do most Maryland residents need to do coming up?
Well, the most important dates people need to know about the Affordable Care Act and its implementation is October 1st is when enrollment begins on the exchanges, the Travelocity of healthcare, where people who are currently uninsured and trying to get policies for themselves and their families can go on this exchange, and it's an electronic exchange, and put in the information about your family's income and how many folks and where your doctor currently is if you have one, and up will pop a bunch of different options that you can choose from. That begins October 1st. And then the other very important date is January 1st, 2014, which is when the Affordable Care Act kind of goes into full implementation phase, when services actually begin for those who were uninsured and now are insured.
Recently, the Obama administration extended the deadline for the employer mandate portion of the Affordable Care Act. What did that mean? What effect do you think that'll have on Maryland residents?
The employer mandate delay, it actually has very little influence or consequences on the average person, because it allowed for large employers to not follow the law for the first year. However, the vast majority of large employers, like well over 90%, actually offer coverage to their employees. So the fact that this is delayed, requiring the employers to do this, really won't have much of a bearing on the average Marylander.
But that doesn't affect the individual mandate, the fact that individuals in Maryland throughout the country do have to get insurance?
Very importantly, the employer mandate delay does not affect the individual mandate, which is where you get a tax penalty if you are not covered as of January 1, 2014.
Dr. Beilenson, thanks for joining us once again for our Evergreen Health Outlook, and thank you for watching. We plan on posting health outlooks to our website on a regular basis on all kinds of topics involving the worlds of health care and health insurance. If you have any suggestions about things you'd like to hear about or learn about, send me an email at mjj@evergreenmd.org.